exploring the root cause of nausea during pregnancy and potential remedies. Hello and welcome to everyone. Today's video focuses on a study conducted by the University of Cambridge, which reveals that a protein called GDF15, produced by the fetus, is the cause of nausea and vomiting in pregnant women. The severity of these symptoms is directly proportional to the amount of the hormone produced by the fetus and the level of exposure the mother has to it. This groundbreaking research has the potential to pave the way for the development of treatments for this condition, such as pre-pregnancy exposure to the hormone to build up resilience. It is worth noting that up to 70% of pregnancies are affected by nausea and vomiting, with approximately 3% of cases being classified as severe. Without further delay, let's dive into our discussion. Research conducted by Cambridge University has provided insight into the cause of nausea and vomiting that many women experience during pregnancy. This study also sheds light on the severe cases, such as the Duchess of Cambridge, where hospitalization becomes necessary due to the intensity of the symptoms. The determining factor behind the mother's level of discomfort lies in a hormone called GDF15, which is secreted by the fetus. However, the severity of the mother's symptoms is influenced by both the quantity of this hormone produced by the fetus and the mother's previous exposure to it prior to conception. In a recent publication in Nature, a groundbreaking discovery has been made that suggests a promising method for mitigating pregnancy sickness. The approach involves the pre-pregnancy exposure of mothers to GDF15, which effectively enhances their ability to withstand and overcome the challenges associated with pregnancy. Nausea and vomiting impact a significant number of pregnancies, with as many as 70% being affected. While the majority experience mild symptoms, approximately 1–3% of pregnant women face severe cases that pose a threat to both the fetus and the mother's life. These extreme cases often necessitate intravenous fluid replacement to prevent dangerous dehydration levels. Hyperemesis gravidarum, the condition responsible for these severe symptoms, is the leading cause of hospital admissions during the first trimester of pregnancy. Despite the availability of certain treatments for pregnancy sickness that have shown some degree of effectiveness, a lack of general knowledge about the disorder combined with apprehension regarding the use of medication during pregnancy results in insufficient treatment for numerous women experiencing this condition. For a long time, the reason behind pregnancy sickness remained a mystery. However, recent findings from biochemical and genetic research have shed some light on this phenomenon. It is now believed that the hormone GDF15, produced by the placenta, may play a role in causing nausea and vomiting as it interacts with the mother's brain. A significant breakthrough has been achieved in comprehending the significance of GDF15 in pregnancy sickness, including hyperemesis gravidarum, through a collaborative effort by scientists from the University of Cambridge, along with researchers from Scotland, the USA, and Sri Lanka. By analysing data collected from women who were enlisted in various research projects, such as those conducted at the Rosie Maternity Hospital, affiliated with Cambridge University Hospital's NHS Foundation Trust, and Peterborough City Hospital, part of North West Anglia NHS Foundation Trust. The team employed a range of methodologies. These included human genetics, innovative techniques for assessing hormonal levels in the blood of expectant mothers, as well as investigations involving cells and mice. The correlation between the intensity of nausea and vomiting during pregnancy and the levels of GDF15 produced by the fetal portion of the placenta and released into the woman's bloodstream, as well as her sensitivity to the nauseating impact of this hormone, was demonstrated by the researchers. In non-pregnant individuals, GDF15 is produced in minimal amounts across all tissues. The level of sensitivity a pregnant woman has to this hormone is influenced by her pre-pregnancy exposure to it. Women with naturally low levels of GDF15 in their bloodstream are more susceptible to experiencing intense nausea and vomiting during pregnancy. In their research, the team discovered a scarce genetic mutation that significantly increases the likelihood of hyperemesis gravidarum in women. This mutation is linked to reduced levels of the hormone in non-pregnant blood and tissues. Conversely, women with the inherited blood condition beta thalassemia characterized by naturally elevated GDF-15 levels before pregnancy, tend to experience minimal to no nausea or vomiting. Leading the collaboration, Professor Sir Stephen O'Reilly, co-director of the Wellcome Medical Research Council Institute of Metabolic Science at the University of Cambridge, emphasized that the majority of pregnant women will encounter feelings of queasiness and sickness at some stage. Although this may not be enjoyable, there are instances where certain women will endure severe symptoms, necessitating medical intervention and even hospitalization. The reason behind this phenomenon has been unveiled. The fetus developing in the womb generates a hormone at quantities unfamiliar to the mother. The severity of the mother's symptoms is directly related to her sensitivity to this hormone. Armed with this knowledge, we now have a glimpse into potential prevention strategies. Furthermore, our confidence has been bolstered in the prospect of utilizing a method that blocks GDF-15 from binding to its specific receptor in the mother's brain, as it holds promise for a reliable and secure treatment for this condition. When mice were subjected to intense and immediate doses of GDF-15, they exhibited a decrease in appetite, indicating the presence of nausea. However, when mice were administered a sustained-release version of GDF-15 and then exposed to high levels of the hormone, they did not display the same behavioral response. The scientists hypothesized that increasing a woman's tolerance to GDF-15 before pregnancy could be the solution to preventing sickness. Dr. Marlene Fedso, a co-author from the University of Southern California's Department of Population and Public Health Sciences, has personal experience with hyperemesis gravidarum, a condition her team had previously linked to the GDF-15 gene. During her own pregnancy, she suffered from severe illness, making it difficult for her to even perform basic movements without experiencing nausea. This personal struggle led her to investigate the lack of knowledge surrounding this condition, despite the prevalence of pregnancy-related nausea. With the hope that our comprehension of the root cause of hyperemesis gravidarum brings us nearer to the creation of successful remedies, we aim to prevent future mothers from enduring the same hardships that countless women, including myself, have faced. The study was a collaborative effort among researchers from the University of Cambridge, University of Southern California, University of Edinburgh, University of Glasgow, and Kelaniya University in Colombo, Sri Lanka. The primary funding for the study came from the Medical Research Council and Wellcome in the UK, with additional support from the National Institute for Health and Care Research, Cambridge Biomedical Research Centre. To support our channel's growth and ensure broader awareness, kindly hit the like and subscribe buttons. This will help us reach more individuals and disseminate valuable information. Thank you in advance.